Hi, I'm Ruth Werner, and I'm so glad that you have joined me for this little audio-visual sidebar to my articles on stroke and spasticity that will appear in this edition of Massage and Bodywork magazine. To make this video, I put out a call in my community for a chance to chat with people who have experience of working with clients who've had a stroke, and I feel like I have stumbled into this gorgeous gold mine of information and compassion and wisdom that I'm very happy to share with you here. It's a little longer than the typical videos, but I think it will be worth your time. I have titled this Stroke Across the Spectrum because it begins with a massage therapist who describes using her skills as working with a child who'd had strokes, helping him to recover some function in his affected arm and leg so he could be an active, happy little boy. Then the middle interview, I got to chat with a massage therapist who herself has had strokes, and she describes that experience in ways that can help us really understand and sort of get behind what our clients are going through. And then in the last video, I had such a lovely time talking with my dear friend Ryan Hoyme about his experiences working with patients who've had a stroke, and he works in a hospice setting. So we really are sort of running the arc from working with young children to adults who otherwise seem pretty healthy to people who are at the end of their life. What all of them have in common is that they've had this central nervous system injury. I often say that if I were ever to get back into practice, this is the population I'd really love to work with, because I think that the power of informed, welcomed, educated touch to improve the quality of life for people with central nervous system injuries is yet to be fully explored. We have so much good that we can offer. And my great thanks go to the people who contributed to this video to help us understand that, and I hope that you enjoy it. You are the first of probably 3 or 4 people that I'm going to chat with about this.
Okay.
I have written a feature article for Massage and Bodywork magazine on
Oh,
stroke.
nice.
You reached out to me to share some of your experiences and priorities about working with people who have had a stroke, and it was
Hmm.
really thorough and well thought through, and very much along the lines that I was compiling anyway. So that was validating, I think, for both of us. Yeah, so you've ended up with several clients who have had strokes, yes?
Yes, quite a few.
I think I'd like for you to tell me what you think someone who has a new client who's had a stroke, who's basically well educated but has
Right.
never dealt with this kind of situation before. What do you wish you had known before you got
Um,
started?
okay. Um, I would say throw out your preconceived notions. Um, just throw out your pity, throw out your doom talk. You can't be an ally if you're doom talking and pitying them.
Right.
Um, and I can't tell you how many clients I've had who've had stroke who've said, "Oh my God, you're the first person who's talked to me like I'm a human being."
Mm-hmm.
And that just makes me sad.
Yeah.
Um, and the other is be curious. Like, I'm curious by nature, so like I kind of already had that, but like don't be afraid of a really in-depth intake interview. Um, because and don't be afraid of what so many people will call TMI.
Right. Too
Um,
much information.
because oftentimes those little TMI nuggets were the clues I needed to get to a place where to be like, oh, that's the key. That's what I need to focus on. That's the thing.
Tell a short story if you can, and a little I have a client whose story about an experience of working with someone who's had a stroke.
I had a child, mother brought a child in who had a stroke as an infant.
Hmm.
He had some speech impediments. He had a lot of spasticity.
Hmm.
And so we would work on that. And he was coming in for weekly for a while. Um, And it was all just super gentle, like the skin stretching techniques that I was telling you that I used, a lot of like myofascial DNM type things.
I
This
struggle
is
with.
the gentle, this is just like you just place your hands on, and that very first barrier you get to, you stop.
Hmm.
Like it's really more that skin stretching at the most superficial barrier. And he would come in with, sometimes the arm would be the worst and sometimes the leg would be the worst, and he'd only have a half-hour session. He was still going to PT, and his mom told me, the times that he comes to see you are the time are that's when he makes the most progress. Meaning that he got more range of motion. Yeah, so it was more than just the physical movement, like his arm or leg, whatever we had worked that day, just felt more, like more open. Like even if he couldn't move it more, he felt like he would have been able to. He was just more comfortable. We often would switch back and forth. So like one week it would be the arm, and the next week the arm was still feeling okay, so we'd work on the leg,
Oh, that's
sort of
great.
a thing.
Yeah.
Yeah. But with the spasticity and only a half-hour session, you can't get as far as you want to
Right.
in any one session.
Great. Well, thanks so much, Shell. Keep up the good work. All right. Well, thanks very
Right.
much.
You're welcome.
Take
Have a
care.
good one.
Bye bye.
Okay. My name is Erin Donnelly, and I have been a clinical massage therapist for 23 years. I own Tahoe Clinical Massage and Bodywork in South Lake Tahoe, California. And I am a two-time stroke survivor.
That's amazing. Erin, can you tell us just a tiny bit about your strokes?
Yes. So I have a rare genetic disease also called pseudoxanthoma elasticome. And that's part of why I've had these strokes. So my first one was in February of 2018, and my second was during COVID of March of 2020. And both of mine, they believe, were because of inflammation due to the closure of my arterioles that I have from my genetic disorder. And so inflammation after illness has caused me to have two strokes.
Okay, so they were ischemic strokes rather than hemorrhagic ones,
Correct.
right? Okay. And can you tell us, I felt it would be so interesting to have your input because here you are a massage therapist and also
Yes.
someone who has been through this process. Can you give us just a tiny bit of insight into what, especially your first stroke experience was like? Did you know what was happening?
No, I had no idea what was happening. I have a service dog for my medical disorder as well. I have some episodes that take place that kind of feel like you are tranquilized almost. It's from a lack of blood flow. I think it's a full body intermittent claudication episode. And so she didn't give me an alert. And all of a sudden I went down in between clients. My client had just left the office. I thought I was kind of off that morning. So I let her know ahead of time that I wasn't feeling great, but we decided to proceed with the massage anyway. And right after she left, as I was cleaning my space, I wasn't feeling right and I fell to the ground. I took a picture of my face to see if I had an imbalance. I didn't see one, but it was hard to tell because I was not in a great frame of mind. I waited there for a little while, maybe like 10 or 15 minutes, and decided it was safe for me to drive home. I drove myself home. I took a shower. I went to sleep. And when I woke up, I thought I had a heart attack during my sleep. So the symptoms masked themselves. And I woke up with just chest pressure. So we went to the ER thinking I had a heart attack. They didn't find my stroke for a year and a half.
Okay,
Yes.
so would it be fair to to describe that then as a transient ischemic attack?
No, it was not because they found it in the MRI a year and a half later.
I
So
see.
there
Okay,
was
so there
damage
was
done to.
permanent damage,
Correct.
but they just
Yes.
didn't, and they didn't. Okay,
Yeah, because when I went to the hospital, I went to the hospital with what they thought were heart attack symptoms.
right.
So
So they
they
didn't
tested
look.
me. Correct. So we tested me for all the heart things. I mean, they even put me on bed rest for a month and a half waiting for my stress test because we were terrified that something bad was going to happen. And so, because of all my genetic disorders, we went with what we thought the symptoms were. And it wasn't until I went through further testing in a different state later on that they found that brain damage. And so The stroke specialist that I saw at Evanston Hospital in Illinois decided that there was a stroke that had been present at that time.
And then your second stroke, how did that
That was from COVID. So I was one of the first people who got COVID. And so by March 5th of 2020, I had COVID. By March 18th of 2020, I was in the ER. At that time, they diagnosed it with as a TIA. But in the 4 years since then, I still have permanent damage on the left side of my body. I lost feeling, and that never came back. So my physician out here has decided to change the diagnosis from a TIA to the stroke diagnosis.
So can you talk a little bit now about your long-term repercussions?
Oh, yes. Yes. So I have a lot of brain fog. It's been a lot of challenges with returning phone calls, returning emails, writing those types of things. Sometimes even talking to clients, I'll get brain fog, and trying to explain something to someone in the middle of a brain fog attack can be very challenging, especially since I focus on clinical injury rehabilitative work and chronic pain management. And so I have to explain health issues, and just trying to do that when I'm in a foggy state can be a very challenging thing for me. But most of my clients are very understanding, and they know that I'm a stroke survivor, so they work with me in those states.
So are we calling that kind of brain fog related to your stroke or long COVID or both?
I'm pretty sure I'm pretty sure it's a combination of both.
Yeah.
Because my first stroke definitely caused some brain fog, but the second one, because it overlapped with COVID, it's so hard to differentiate how much of that is left from the stroke and how much of that is left from long COVID. So that's a challenging thing to answer.
Sure.
But I definitely, it's been a huge challenge for me.
Yeah. How about musculoskeletal weakness?
So my left side, I lost feeling on, and it's not gone completely. I like to explain it as more of like, I feel more superficially on this side and not as deep. So if you're going to palpate both sides of my body, I'm going to feel normally on my right side. But on my left side, it's going to feel like you're not pressing as hard, and it kind of spreads out over the surface of the skin rather than feeling the deep pressure in my musculature.
Interesting.
It is. It's very interesting. I thought it was very fascinating.
And so your main repercussions then have been sensory,
yes.
Okay, rather than spasticity or something like that.
Correct. Yeah. Yeah. So I have definite long-term, like there is a change in the feeling on the left side of my body that has not changed since I had that event.
Right. Right. And how old are you? Do you mind if I ask?
I'm 46. I'll be 47 in about a month.
Okay. So you had your first stroke at age
40.
40.
Yeah.
And then again, 3 years later.
Correct.
4 years.
3 years.
3 years later.
3 years. Hold on.
Anyway.
Math and me. That's another problem. Nowadays, doing short math like that is, extremely challenging. Sure. Things that I would expect to be easy can sometimes be really hard. Just, to-do lists and tasks like that, following through with little things that most people would find really, really easy. That kind of stuff.
Erin, you receive massage every week, you said, yes?
Correct. Yes.
And your massage therapist is familiar with your medical history?
Yes. And I see multiple massage therapists, so I don't just go to one. I like a variety of work.
Do you receive massage on the left parts of your body where the sensation's a little distorted?
Yes, I do.
Do you find that makes any kind of difference for you at all?
Overall, yes, it's great. Massage is a very important part of my life. I honestly wouldn't be able to continue to be a massage therapist if I didn't receive every week. I look at self-care as a very important part of my practice and consider it part of my overhead when looking at budgeting. Even though I'm not, able to write it off as my overhead, I consider it my overhead. And so it's helped me tremendously. Has it brought back any of the sensation at all? Absolutely not. Nothing has changed as far as that's concerned. So I do have to be a little bit more careful when receiving on the left side to make sure that they're not going to go too deep or injure me or anything like that. Those are definitely precautions that I keep in mind when I'm receiving.
Can you give us in a bit of a nutshell what you would like for massage therapists to know before they begin a professional interaction with someone who's had a stroke?
Just really listen to your client. I mean, I think that that's important with anything, no matter what it is that you're working with. They're going to know their bodies better than anyone else. And, I mean, really, truly understanding that their perspective is very important. And not just glossing over the I know better because I do this for a living, because I have had that happen. And that's when I get bruised, and that's when I get injured. And that's when, maybe they don't go less pressure on the left side when I warn them that I have sensory issues there, or maybe they don't check in as often with that type of thing. So that's the thing that I really stress about any massage, though, is listening to your client. And if you're scared, then I know doctor's note isn't really going to do anything to cover them, but, having a conversation, if they have that option, is definitely something that I encourage if it makes you feel more comfortable working with them.
Mm-hmm. Mm-hmm. That's a wonderful encapsulation. Erin, are you considered by your healthcare team to be at risk for a future stroke, probably because of your genetic conditions?
Yes, because of my genetic condition, but not it's not heightened because I had the stroke.
Okay.
So they told me that there's
the case. I mean, the opposite would be true for someone.
Correct.
Did not have your underlying situation.
Yes, I'm a very rare case. So I have a unicorn disease, very rare people. You're not, chances of having someone like me on your table is not going to happen. There's 5,000 of us in the world. So maybe one of you will get me one day, but chances are pretty slim to find someone with PXE. It is a connective tissue mainly. It affects my connective tissues. So massage is also very important because I have a lot of fascial restriction and things like that. But I mean, I don't know. I think that just really listening to your clients is always going to be the most important thing.
But I want to just really thank you for taking some time to talk with me about this. It's so seldom that I get to talk with someone who's so knowledgeable about what's going on with their situation and so very generous about sharing it with others. So thank you so much, Erin.
Well, thank you so much for having me. I really appreciate your time.
All right. Thanks. Bye-bye. Hi, I'm so happy to welcome you, Ryan Hoyme, to this discussion about working with clients who have had a stroke. Can you just, for the 3 or 4 people living under a rock who don't know who you are, can you, I might cut that. Can you please introduce yourself?
Don't cut it. My name is Ryan Hoyme. I've been a massage therapist since 1997. I've taught for over a decade. I worked in a few different hospitals as a massage therapist. I'm currently working in hospice right now too, and for Moments Hospice, and I absolutely love it.
Yeah. And just for background, you are also the massage nerd and have been very instrumental in promoting the profession and education around the profession. So we're all very grateful to you for that work as well. But the reason I asked you to join me today was specifically, I wanted to talk to a few people. You'll be the third of the 3 about their work with clients who have had a stroke. And so if you can, in a nutshell, maybe think of 1 or 2 people in particular and talk about what that work was like. And in particular, talk about if you saw changes happen.
Okay. One thing about hospice, and especially if they have a stroke while they're on hospice, technically they're not supposed to have physical therapy at all. So that's why massage therapy is so beneficial during this process, because if they want to stay on hospice, they're not allowed to have therapy because they'd have to come off of hospice then. So that's one thing that a lot of times nurses will put an order in for massage just to help with those things, just because, again, they're not able to get physical therapy then.
And what are you specifically helping with?
More for circulation. I do some just minor stretching with my patients too and stuff, but It's it's very hard just because they know they might want to come off a hospice, but it all depends on how severe their diagnosis is for other things too then. But the majority of them just stay on hospice and just expect the outcomes then too. But massage and even music therapy we have too just helps with relaxation and everything else. But for massage, of course, I kind of access it, especially going. I always start on the unaffected side first, just to kind of get a feel for the muscle tone and everything else. And it's a lot harder when they can't communicate too. So that's why I definitely have to look at more of their nonverbal reactions to any kind of discomfort at all. So my belief, definitely the first time I ever see them is always lighter the better kind of thing to start
Sure.
off with. And the next time I see them, might increase the pressure just a little bit and stuff, but always make sure that I'm aware of everything that's going on with the client, with the patient then too.
Yeah, special extra uh, um, conscientiousness about those nonverbal signals. Have you had people give you nonverbal signals that said to you, "Oh, cut that out. I don't like that"?
Yes, I've had that just a couple times. I've had that, and the thing is, sometimes it might be a little twitch, and it might not even be anything with the massage at all. But the thing is,
Sure.
I still have to abide by it then, and back off or go to another area then of the body to massage. And the nice thing is sometimes there are family members around, so I can ask questions too, and how active they were before. So especially if this is my first time seeing the patient, I read over all the documentation, what the nurses did with the intake, really in depth, but I really want to get a feel for what the family members have to say about everything and what they've done in the past too then.
Are you allowed to teach family members any simple things that they might be able to do?
Yeah, just minor things and stuff. But massage related, yes. But other healthcare things like transferring,
Oh,
positioning,
yeah, no, I'm not
those
talking
kind of
about that.
things. Yeah, yeah. So those kind of things I gotta kind of shy away from.
Sure,
But
but
yeah,
just, how to
yeah,
lay on a hand for full contact
yeah,
and how
yeah,
to watch for those nonverbal signals and things like
yeah.
that. That seems like such a lovely thing to be able to teach a family member. If you were talking to someone who's thinking, wow, I would really love to work with people who've had central nervous system injuries. I'd really love to work with people who, have had this progressive limitation just to see how much of that manual therapy might be able to influence. What kinds of things would you like to see people entering this part of the field to know?
Um, well, when I taught massage, one thing a barrier that I kept running into a lot of times is a lot of my students were scared to touch older people. So it was so that's why a lot of times we did field trips to nursing homes, assisted living facilities and stuff. But the thing is, they're of course more likely a little bit more fragile and stuff like that, but I love hearing their stories. I mean, that's what I really crave, and I don't care if I hear the story 10 times and stuff like that. I'd love to hear about their past and their wants, their needs, everything else for these things. But I myself, I've worked a lot with people with quadriplegia, lupus, you name it, and stuff. But especially with quadriplegia, I mean, they think some therapists think, oh, you don't need to massage their legs or their arms or other areas and stuff that they can't move and stuff. But it's actually beneficial because a lot of times they do have contractures, so they'll have twitches, you name it, and stuff. They'll have these kind of symptoms.
And
Uh,
sensation is still
yeah,
happening.
yeah,
So is
still
pain.
happening. Yeah,
And that's, I think pain is a really
yeah.
I think pain is a really underaddressed complication of having had strokes. And that's something that really almost no one else on the healthcare team is in a position to address hands-on.
Yeah.
So,
Yeah, and I love massaging people that are amputees too, because
mhm,
the times they have like phantom limb pain and stuff. And I mean, they just, I mean, sometimes people are just so scared to touch those areas.
right.
Not necessarily massage therapists, but other healthcare professionals or
Or
these
family members.
family members and stuff too and stuff. But
Yeah.
mean, it's just it's making them feel like a person then, because when somebody has a disease or some certain pathology and stuff like that, it's some people are just scared of that. But the more education I can give to these family members too, it's going to help them out in the long run too. So
Ryan, I want to thank you so much for taking some time out to talk about this. And maybe you and I should talk some more about maybe doing some interviews on I Have a Client Who, just to maybe help to demystify some of those fears that people have about working with clients who are elderly or clients who are paralyzed or who have other kinds of disabilities. I think that would be an amazing thing to be able to do.
yes, definitely. Anytime, just let me know. I'm here
Oh,
for.
thank you, son.
Yeah, thanks, Mom.